County Administrator, great to see you. Okay, so I've missed you.
We've kind of missed you.
No, you haven't. All right, so we'll get going. I got lots of news to discuss today since I haven't been here for so long. I've tried to put the graphs so that you could see what we saw last commission meeting and then this commission meeting. So let's get going with, first of all, our national trend, which as you can see, nationally, the cases went up a little bit and then they've started to come down again. This is this little blip that started going up here, but the trend now is, they say it's going down again. And the deaths have remained going down, so that's good news. The next one is our U.S. 7-day daily positivity rate. Unfortunately, we're in the, not the real dark blue, which is a higher number, but we are in the 8 to 9.9 positivity, which, as you know, anything above 5 is community spread. So Florida, Louisiana, and Alabama, we've got a little bit of problem here, as well as Utah. And then there's no data from these for this period. They are reporting, it just we don't have it for this month, for this period. A needle today helps keep COVID away. So this is the main message being given by the CDC. And they're talking about the problem with the Delta variant. It's highly transmissible. That means it's more contagious. It continues to spread across the U.S. at a very rapid rate. The Delta now makes up more than 50% of the cases that we're seeing, of the new cases. And cases and hospitalization are on a rise in areas where there's low vaccination coverage. That makes sense. The recent weeks show that the adults ages 18 to 49 now make up 40% of the hospitalizations related to COVID. So this Delta is very, very important, and we need to continue to follow it closely. The CDC is the lead agency for the variants, and you can go on the COVID track. I have used that data source in all these slides, and this is what it looks like, okay? So this is the dark orange is the Delta, and you can see how much it's grown from just in 2 months, how much this little orange bar has grown to this point now. And it is, because it is so contagious, it's very easy to spread, especially if you're indoors and at events. This is another graph that shows you, I'm sorry, that shows you by regions. They've divided the country in regions. This is Florida, Alabama, Mississippi, Kentucky, Tennessee, North and South Carolina. That's our region 4. And we have a little bit less than these other regions that have quite a bit. And you know, it just shows you. So we don't have the most Delta, but we're certainly concerned, and we have to keep following this very closely. This is the picture of Florida at our last meeting when we were here. It showed it from May through June. We had turned yellow. I was hoping that we would turn blue, that our county would turn blue to low. We were very, very close. We ran down to 2% of daily positivity rates. We were doing really, really well for a long period of time. And this is what we look like now. So you can see that the substantial have turned to high in Dade, Broward, Hardy. I'm sorry, I got 2 Hardys. Henry, no, yeah, Henry. Yep. Hardy and Hernando have turned to high. Martin County turned from yellow, from moderate, to high, and almost all of this north that was all yellow has turned to high also. So very significant, and therefore we are in wide community spread now at this time with our substantial rating. This is the weekly report that we get from the state every Friday, and it basically shows the total number of new cases, the positivity rate, as you can see, 7.8, that's way above 5. So for the state overall, we definitely have community-wide spread. The deaths remain okay, and you see the people that are vaccinated and how many have completed the series, and then the age groups. The total is, for the Florida, is 58%. This is that they've received one dose. 58% have received at least one dose. Again, this number is very high because of the 65 and over having received 83%, and the 60 to 64 with 74%. So these high numbers make the total look very high. But I'll show you another graph where we actually see the rate of these folks. These are the new cases for the past 10 weeks. You can see that they have gone up, and the new case positivity for the past 10 days, again, it had gone all the way down to below community spread, and then now it has risen up above it. And this is what our counties look like. The blue numbers are what we had at our board meeting on the 8th of June. And now the new data is in red for as of 7/9. These are the dates that I have. So you can see that the people vaccinated has gone up. Miami and Broward are doing better than we are. They're at 73%. 66%, and we're at 62%. The cases, you can see, they have a great deal more positives than we have. We've maintained that ratio. The case positivity, that's the total, what we call the total positivity, 19.1. Now theirs came down. You see that? And ours is down from where it was before. Okay, but our daily positivity has gone up. And then this is the number of people vaccinated. This is for the week, as opposed to the whole cumulative. And so you see the new cases, a lot more cases in Miami, and then the daily positivity, 5.3, 5.5, and we're at 6.9. According to this is the previous week, all right? This is the Friday positivity that they give us. And then this is a very important one, because this is, a lot of people like this better, because it shows you how many cases per 100,000 of the population. So you can see that Miami is at a much higher number of cases per 100,000 as opposed to Broward, and then we're down at 92. So this is just so that you can see what we're looking at and how we're comparing with our neighbors to the south. This is the part where you can identify then what does it really look like in terms of the age groups. So when you see here for all ages, we're at that 58%. We've improved the percent of vaccination by 5% statewide. Okay, and then I did that for each group. So the group that has increased the most is the 12 to 19. Okay, and that's good, because that means we've been vaccinating a lot of the kids before they get back to school. There's been a huge effort here in Palm Beach County led by the healthcare district. They're out at different district sites vaccinating as many children as possible. We're also vaccinating when they're coming in for their back to school vaccines and offering them the vaccine at the same time. The other numbers are about 4%, averaging about 5% between all the other age groups. So we're still vaccinating more people, but it's much, much slower than it was before. Okay, and then you can see the total positivity as well as the daily positivity, and you can see that it's really high especially for the 12 to 19, up to 10.4%, the new case positivity, and then it goes down as you go to the 65 and over, because they've almost all been vaccinated at about 84%. They've been vaccinated here in Palm Beach County. So this makes sense, and it just helps you also look at that cases per 100,000, where you see that the number here is the highest in the 30 to 39-year-old, and this whole group here, the ones we've been talking about all along, these are the ones that are most likely, and also the most likely to get infected. This is our Palm Beach County coverage by age group. We're measuring it. This is the population that they're giving us, and we have a little different breakdown. It's 12 to 14. We're at 17% with a completed series, and that's what really counts. That means you've been fully vaccinated, and 25% with just at least one dose. This has only gone up by 1%. So you see these first 6 all the way up to 35 to 39, it's only gone up with 1%. So it's very, very slow. We don't see the numbers we used to see before of the 1,000 in one day. We're seeing now 10, 15 people at a time. And then some of them have not increased at all, even though we are continuing to vaccinate, but it's just very, very small numbers. So in total, we've actually gone to 62% who are vaccinated, and 54% have completed their series here in Palm Beach County. And that has increased by 1%. Then we have our map, which Mary and the county so gracefully have helped us to provide this. Did you want to put the other one up, or is this? That looks much prettier. That color looks prettier. Better blues. But we see it hasn't changed very much. This is now through June, and we're still through June only capturing the 16 and above, because we didn't start vaccinating the 12 until the very end of June. So we didn't want to put that in because it would be very misleading. But we're still looking pretty much the same with Belle Glade here, Pahokee, South Bay, in the lower numbers of 25 to 39. Each one of these, if you blow it up, you can actually see the numbers for each one. And then you have your very high concentrated in the elderly communities along the island and up in Tequesta. We have our North West Palm Beach, Lake Park, Riviera Beach. We have our South Quarter, Lake Worth, Lantana, and then this section here in Delray between I-95 and US 1, right around Atlantic Avenue. So those are our spots that we're concentrating to go out and vaccinating in those areas as much as possible and trying to drum up business. This is a slide that we created. This is with our own data, and what I'm showing here, the red is starting in March of 20. When we began, we saw it starting to go up all the way up to the peak in July, that peaked here in 2020. And then it went down a little bit, and then it started going back up, and through September, then we had the holidays, and it continued to go up through December, and then finally the big peak in January of 21, right? So starting in January 21, the purple is now the numbers that we have now. We have seen a steady decrease of those cases, new cases, all the way here, especially drastically decreasing as that positivity went down below 5, all the way to 902 cases. Now, the problem is that this 902 is only for the first week in July. So we've been now averaging, we went from 50 to 60 cases per day, we're now at 300 and 900 in that first week, okay? So we're averaging around 300 per day. So if this continues and we have 900 per week, we could reach 36,000, which will be a little bit higher than what we had in June, but not as high as what we have last year in July, okay? Definitely not as high. Now, what will happen now as we get into the summer with the travel, with the holidays? Will we see a surge, or will this just continue to wave up and down based on how much vaccination we do? So we are hoping that the vaccine is going to keep this from the surge that others are predicting. Okay? So the key in all this, I also want to show you one more picture. This is our new COVID cases from July 2nd to July 8th. These are the new cases that we have weekly. And we've been running these maps. So we're starting to see not the dark red that we were seeing before, the 24 to 60 cases in these census tracts, but we are seeing the 14 to 23 in these little darker spots. The Belle Glade, Pahokee, that whole area remains between 8 to 13 cases, so on the low end. And there are many areas that don't have enough cases to identify, so less than 6, 5 and below. So that's a good thing, because before we were all red. At one point we were all red, if you remember. So we're holding our own, but again, very concerned, and we got to keep our eye on what will happen with the travel, with the holidays, and as we go forward. So the efforts have to be on vaccination. There's no question about it. We will be done at the Mid-County Senior Center down in Lake Worth. We're going to do our last dose on the 14th of July. We're moving out to be able to go mobile and deploy our 2 mobile vans that we have at the health department. The healthcare district is doing the same thing with their mobile vans, all 3 of them. They're providing both a mobile van as well as we are also providing going to hard locations where we are invited in and we vaccinate from a specific location. We will be doing both Moderna and Pfizer vaccines with appointments and as well as walk-ins. We're promoting our website and the calendar. We're doing press releases, both the healthcare district and us. We're coordinating to make sure we don't overlap, that we're not in the same places. And we're also vaccinating children for back to school. We will also promote the COVID vaccine for 12-year-olds and older at both the DOH and the healthcare district facilities. And the Florida Department of Health has been offering $10 grocery vouchers with each vaccination. We continue to serve our Seal Brumback Health Center in Belle Glade, where we're including both vaccines as well as testing with both the PCR and the rapid test. And we're also doing the same in the Lantana Clinic at 1250 South Wind Drive in Lantana. And this is for the general public. The healthcare district is also vaccinating the public at this site. The healthcare district is vaccinating at school sites with mobile units. They're addressing the entertainment and the lower vaccinated zip codes and vaccinating their underserved populations through their federally qualified health center clinics. Our biggest distribution of vaccines has been helping community partners who need vaccine to vaccinate either their own patients or their group of clients or staff. So we're happy to go out to businesses to help them vaccinate their staff. We want to make sure that anybody that wants a vaccine in Palm Beach County can get one. We need everyone's help to do this. So please, as a community, let's do everything that we possibly can to make this happen. We got to get the word out to vaccinate, vaccinate, vaccinate. We want to hear from community faith-based, the leaders, any grassroots groups that are getting together, students or even businesses, small or large. They can help us connect with the folks that they want to get vaccinated, who have not had the opportunity or we're still hedging to do it. Let's see if we can convince them to go ahead and get vaccinated. And maybe they just haven't been able to have the availability of having the vaccine because they're working and they can't get out. So we're happy to go to businesses and do that. We also want to rally your constituents, your HOAs, sports clubs, any group who wants to know more about the COVID vaccine. We're happy to go out and do lectures. I've got a setup at one of the major hotels in Palm Beach. They want to vaccinate more of their staff so that people that are coming for vacation can feel safe, and they want to be able to say that their staff has at least 70% vaccination rate. And we will set up these learning or listening sessions. We're happy to do that. You can call the DOH at 561-625-5180. I've told them they may get calls today. Any group that wants us to come and help them to submit requests for vaccinations, or you can go to our DOH website, which is right here in blue, pbchd.com. That's the health department website, Palm Beach County Health Department. That's what those initials stand for, pbchd.com. And look under immunizations, and you'll see where you can set up for request. The healthcare district has a site under their organization, Healthcare District Palm Beach County, is HCD-PBC.org. You can see how similar those two names are. And that's okay. If you get the wrong one, we'll do it anyway. And they're under the mobile clinic and community event request. If you click under there, they have a form that fills out, and you put in your name and your address, your email, and they will be able to make those requests for you. So that's it. We want to vaccinate. That's the only way we can keep this COVID down and keep people safe so that it doesn't get to the big surge that we had last time. And we avoid, therefore, those hospitals surges that we don't want to see. I'll give it over to Mary.
Very good. Thank you, Dr. Alonso. We'll move now to our emergency manager, Mary Blakeney.
Good morning, Mayor, Vice Mayor, Commissioners, Administrator Baker. I'm presenting to you the COVID Restart CPR program. You all have continued to receive the matrix, but as a point of clarification, as of June 3rd, the state is no longer collecting a majority of the data that we were previously presenting to you all within our update. So the remaining data available to us is what we'll be presenting today. The upper right-hand graph shows the overall positivity rate, which had been decreasing for the previous 9 weeks. Currently, we're at 15.9%. The lower left-hand graph indicates the positivity rate over the last 4 weeks of testing. As we continue to look at the positivity rate, the graph on the upper right shows the daily lab positivity rate since last July. The lower left-hand graph shows our daily lab positivity rate this week averaging at 6.9%, which is above the targeted 5% that Dr. Alonso mentioned in her report. This is the first week our weekly lab positivity rate has been above 5% since May 4th. The graph in the upper right corner shows that our COVID-19 related deaths remain stable. We did see a slight increase in the number of deaths when the state reporting system changed at the beginning of June. Our current death rate currently stands at 2.44%. Palm Beach County Fire Rescue still continues to do a random sample of people with COVID-like symptoms who call 911. These individuals are listed as med alerts. We can see by the chart in the lower left-hand corner that med alerts have increased. This past week, the average was more than 3 patients a day. With the emphasis on encouraging residents to get vaccinated, we continue working with our Public Affairs Department to provide a list of resources on our county website where residents can go for testing and vaccines. It's easily accessible at pbcgov.org. In addition to the Health Department and the Healthcare District sites, there's a lot of information on this site we encourage residents to be aware of. So although our community response to vaccines has slowed over the past few weeks, we have vaccinated over 811,000 people in Palm Beach County, which represents 62% of our population that's 12 years of age or older. We continue to encourage people to get vaccinating while still wearing masks, washing hands, and watching our distance. That concludes my report.
Very good. Thank you, Madam Emergency Manager. We'll now turn to questions from members of the board. We'll start with Commissioner Weiss.
Thank you, Mayor, and thank you both for your excellent reporting. And this is very troubling to hear this going on after so much good work being done in the community. I wonder, Dr. Alonso, one of the things, and this is anecdotally that I heard through from a constituent, folks wanting to get tested that may not be non-documented people, and with the sites, the public sites being closed down now, and there seems to have been or is potentially an issue with people knowing where to get tested, for free, that they don't have insurance and those kinds of things. Can you address that?
The testing continues to be free at most of the, I don't want to call out the names, but CVS, Walgreens, Walmart, these places are still testing for free at no
But don't you need to be
cost.
documented and have the proper ID in order to get
The
that?
problem is that sometimes they get asked for the insurance because they will bill the insurance for the administrative cost. And sometimes when a person gets asked and they're undocumented, or they even fear that they may get asked, they will not go. So for that reason, we have continued to test. Now we're testing the public at the Lantana site as well as in Belle Glade. And the healthcare district is also testing. So we're testing our patients, we're testing them in our clinics, and we have the sites in Lantana and these other places. Now, we can also set up testing for specific events if they want testing at a site, okay? So we're trying to work that very much on a one-on-one basis. When they call us, if they have any doubts, we can take them at those sites that we have.
Well, my concern is, because of this, is that there's a large underreporting of what is actually happening in our area because people are not getting tests. I know our testing numbers are still relatively, I think, what is it, about 7,000 or so, but it's not, with this uptick in cases that we're seeing, I also fear that there is a large number of people not knowing where and how. In this case, this was somebody who ended up, we got them over, I think, to Found Care to get tested, but they live in a household with 7 other people.
Sure.
And and by the time they got tested and found out, everybody else had been exposed.
And that's one of the disparities that we have seen that this pandemic has actually highlighted, is that many of the folks that are working in our establishments, in our restaurants, in our hotels, don't have access to medical care. And that's the bottom line. And they're afraid even to go where it's free because they're afraid of being asked for documentation, unfortunately. So we have been very attuned to that, and we're encouraging them. We're speaking to all these different minority groups. We're giving them lectures. We're talking. I have a gig set up where I'll be speaking Spanish, Creole, and English, I think. I'll try to speak English. And so it's very, very important to communicate with these communities, communicate with the community leaders so that they know how to help them and how to get them through to those issues.
One of the other concerns I have is our State Department of Health and their messaging or lack thereof of information regarding the vaccinations. I recently traveled on county business out of state and saw what is happening in other areas. And literally, you turn on the TV and there is just seems like a regular barrage of messaging coming out regarding the vaccinations. In a very positive way, not in a fearful way, but in a positive way, and talking about some of the misinformation regarding those vaccinations. Is there do you know if our state of Florida Department of Health is going to be doing anything?
There is talk about it. I haven't seen anything specific, but we're going to take care of that ourselves. We had a very robust conversation last night, so I'm sure Ms. Baker would be glad to update us on that if you want to, if they choose to ask you. So I think we're not going to wait. We're going to do that ourselves here.
It still concerns me, though, because people move around. Everybody's not in Palm Beach County, and we should have a unified message, to our folks here. And then the deaths. As we know, there's a substantial lag between new cases and the reporting of deaths. And we've been averaging 31 deaths a week here. And my concern is that after we've now seen this uptick now, and it seems like this new Delta variant is making people sicker, and hospitalizations, more people going to the hospital, which ends up, can you comment on that?
Yes, it appears that it is more contagious and it spreads easier. However, it doesn't seem to have a more lethal death rate than the regular COVID. However, we are seeing that 40% of hospitalizations being from that 18 plus age group, which is very unusual, right? We were seeing people more elderly going to the hospital and getting sick, and the younger group pretty much avoiding that altogether. I'm concerned about the universities. I'm concerned about, how that will affect, especially playing sports and everything else that will be going on at the university levels, and how that will translate that into hospitalizations for a younger age group. And the consequences, again, from the youth getting COVID and the long-term consequences that they may have. It's very sad to see somebody who was healthy playing football all of a sudden on 4 inhalers to try to breathe, or having problems with a heart issue, or other issues. So even loss of taste and smell can completely alter your life in terms of how you eat and are able to enjoy food. So all these consequences are consequential and concerning going forward into our future.
And I've two more things to ask you about. One is about the mutations, and now we've seen Delta. We saw other mutations prior to that, and my understanding is there's another one called Delta Plus that's now over in India, and this continuation of people getting infected, allowing the virus to continue to mutate into something, that potentially our vaccines are not going to be effective against.
So
And that's
far, the
very
vaccines
concerning.
have been effective against the Delta and the Gammas and everything else, but the virus is doing what a virus does. It continues to mutate to try to overcome the immunization, the immunity that is created in the community, right? So by becoming stronger, it can affect more people, and it can continue to spread from person to person. That's a natural process of a virus. This is not new. So the fear is that because we're not able to get that herd immunity that we were looking for, because of the hesitancy that we've seen, that we've never seen before in this large scale, that those variants will be able to become more predominant and overtake the other viruses, the other strains.
Right.
That's the concern that everyone has that is working in the virology of this COVID, which makes it different than we've had in the past. Like that didn't happen with H1N1.
And then lastly, I see you and Ms. Blakeney are wearing your mask. Can you talk about mask usage and recommendations?
Sure. The vaccine is very, very effective. It's more effective than we even thought. They're 95%. It's even better than that. We see the breakthrough is less than 1%. So the vaccine is very effective. But people do catch COVID. Most of them do not die if it's a breakthrough. It's a very small percent that end up dying, but there have been deaths. My concern with the probability of my being able to catch COVID is that I would spread it to someone else. I'm not really worried about myself that much because I think I'm very well protected, much more protected than driving on 95, okay? But I'm not comfortable even with the possibility of my spreading it to someone else. So I will continue to wear my mask because there's a lot, now there's wide community spread. There's no question about that. I mean, that's a fact. So when I go outdoors, or even when if I'm walking by myself, no, I don't need a mask. But if I'm in a crowd, if I'm walking downtown, for example, there's people all over the place bumping in and out of you. So I definitely have my mask on.
Okay.
If I go to a restaurant, I will wear my mask. When I sit down to eat, I take it off.
Thank you.
All right, thank you, Commissioner Weiss. Move now to Commissioner Sacks.
Thank you very much, Mayor, and thank you, Mary and Dr. Alonso, for all you've done to get us to this position. I have a couple of little questions. Actually, my concerns lie with those who are undocumented and who may be working in our farms and especially in my district and some of the large growers. What have we done, or what can we do to bring the vaccines to them? And I'm talking about our undocumented workers here in Palm Beach County.
Well, what we did before they left is we went to the growers and actually went to the facilities where they were working, and we went to them. We want to do the same thing again now. We've been working with the community out in Belle Glade very, very closely. We've had multiple events. Unfortunately, so far, we're getting low numbers. But I believe that once we set up an actual event to vaccinate the people at the facility, at the growers themselves, or at the farms themselves, we can see larger numbers. So we're working very closely with them to make that happen.
And may I direct your answer to growers in the agricultural reserve? And I'm not talking about the big farms, I'm talking about
Sure.
the smaller container farmers, and asking that I will do anything I can to help facilitate your going there to the growers. We don't have the large farms that may be present in the glades, but we do have workers, and whether undocumented or not, I'm not going to say. But do we have a mobile van that goes out to?
We
these
have
folks?
several mobile vans, so yes, we have plenty of vans to do this, and as a matter of fact, that's exactly what we're trying to do. And it's not just farmers or growers. We have tons of nurseries all around, even interiorly inside our cities. We have nurseries where there's a lot of people employed. They have documentation because they're working. They're not undocumented. They just are scared sometimes with the amount of paperwork that they do have, but they don't have insurance, for example. So when they get asked for insurance, they automatically think they're going to be, they're just scared.
They may be documented for work, but they may not be able to get a driver's license, let's say.
Correct. Exactly.
So in that regard, whatever I can do to help facilitate that, especially among the container growers in the Ag Reserve, we will talk about that, and I'll see what I can do.
I would love your help in that, absolutely. Anybody that you have, just give us a call and we'll make it
Good.
happen.
Okay. And one last question is, what is your opinion of the need for a booster shot for those who have had or, you don't have to give it, but
Yeah,
just
I don't
wondering
see
if-
I don't see any need for a booster shot at this time. The vaccine is holding steady. The antibodies are holding steady. Will we need one in the future? Probably at some point, but there's no sense starting to get boosters until there's a declared. I see advertising all over the place, and I think people are trying to get your money.
People are trying to what?
Get your money.
Oh, get our money?
Want
Oh,
you to
okay.
get more vaccinated.
Okay, but at this point, it really, if folks ask me if they need a booster, if they had Pfizer before, there's really no need at this point to even think about having to
In my
to get a
opinion,
booster.
no.
Okay, thank you very much. Thank you, Mayor.
Very good. Thank you, Commissioner Sacks. And Dr. Alonso, with regards to issues in the future, such as the booster shot, is it really at this point an issue that's being evaluated and researched by the CDC, and guidance will come out on that on a nationwide scale?
Absolutely, and also by the pharmaceutical companies that make the vaccine. It will be in their best interest to make sure that it's done at the right time.